A very good morning to all of you. So our today's session is that of tumor marker. Tumor marker is one of the most important and frequently asked questions for UG as well as for PG. One in cancer. So how you will define tumor? What are tumor markers? So tumor markers are nothing but these are the substances which are produced by tumor cells. Okay. So these are the substances which are produced by tumor cells, or you can define as these are the substances which normal cells produce in response to tumor tissue. Alright. So what are tumor markers? These are nothing but these are the substances which are produced by tumor cells or normal cells in response to tumor tissue, and which can be easily detected by various methods. So this is the definition of your tumor marker. Now what are the characteristics of the ideal tumor marker? So first, it should be specific. What does this term mean? Specific means if you will detect that tumor marker, then that tumor marker significantly present in that tissue. Means that tumor marker is specific for that tissue. Like for example, if you are detecting PSA, like a prostate specific antigen, then that is specifically for your prostate gland. Alright. Second is sensitive. Tumor marker should be sensitive. What does it mean sensitive? Sensitive means if it is present in very small amount, still it can be easily detected. So it should have a very high sensitivity. Third characteristic is it is produced in higher concentration than normal individual. What does this term mean? Means if a substance which is produced normally in the cell, but if a person having cancer or tumor, then that substance should be present in increased amount. Alright. Next is this, that tumor marker should tell about the staging of cancer. Like what is the, suppose if there is an ovarian cancer and you are doing CA-125 for the detection of ovarian cancer, then that CA-125 should tell the staging. What is the staging of that cancer? Whether it's stage 1, stage 2 and further on. Okay. So these are the most characteristic feature of in tumor cells. Now, in which body tissues or in which tissues you will detect this tumor marker? For which, from where you will take the sample so that you can easily detect the tumor marker. The samples which you have taken is that, what samples you will take? The samples which you will take include your blood. In blood, you can detect the tumor marker. Second, you will take urine. In urine, you can also detect tumor marker, and various body fluids. What kind of body fluids in which you will detect tumor marker? It includes like CSF, that is cerebrospinal fluid, or it can be ascitic fluid. In ascitic fluid also you can detect it, or synovial fluid. Okay, so these are the body fluids in which you will detect it. Alright. Now, what are the uses? What are the uses of these tumor markers? What are the uses? The uses you can remember a mnemonic. Okay. Uses of tumor marker. Uses you can remember a mnemonic. Mnemonic is there. S, D, S, P, M, F. Okay. S, D, S, P, M, F. SGS you can remember, like SGS page is there. So by this, from SGS you can remember SGS, PM, fail. SGS, PM, fail. Okay. What is S stands for? S state for staging. So what is the uses of tumor marker? Can use tumor marker for staging of cancer. D stands for diagnosis. Diagnosis. For diagnosis of any disease, you can detect this tumor marker. S for screening. If you want to screen any organ, you have to detect this tumor marker. P stands for prognosis. Prognosis means these tumor marker will tell whether this cancer having a good prognosis or worse prognosis. Prognosis means when you will treat a cancer, then whether this will be cured or not. If that cancer will be cured in a very good response, then that having a good prognosis. If you are treating cancer and it is not going in a healthy way, that means it have a worse prognosis. Okay, so this is the meaning of prognosis. M stands for F for follow-up, and M stands for monitoring. Okay, monitoring. By tumor marker, you will do the monitoring of your cancer. So what are the uses? SDSPMF.